this go. Okay, so I hope you've been able to finish with the colors, light whitish, greenish, violet, light whitish, greenish, yellow. Yes. Can you hear me? Okay, I'm going to turn off my... Can you hear me? Yes. All right. So I hope you've already completed with light whitish, light whitish, greenish, violet, light whitish, greenish, yellow, and the gold. Correct? That's where we ended with the temples. Am I right? Am I wrong? Yes. Okay. So the only thing left is the backhead minor, right? We can project against the three colors on the backhead minor. So let's start off with gold for the backhead minor. Gold for the backhead minor. Then light whitish, greenish. Yes, I know. I've just turned off my Wi-Fi for the video so that the audio is still audible. That's the only thing. Light whitish, greenish, violet for the backhead minor. Light whitish, greenish, violet for the backhead minor. Visualize it going into your backhead and then into the physical eye. And then light whitish, greenish yellow from the backhead into the eye. Once you're done, stabilize and scan all the three chakras, the backhead minor, temples, and Agnya chakra. Let's see how it has improved. Scanning the energy level. Okay, I'm going to try and put my video on now. I'm hoping the Wi-Fi is stronger. Okay, so scanning the physical eye, definitely more energy there. Temple minors. Wow, they become much bigger and stronger. They're literally plump. They're like out there. And then the Agnya chakra is also become bigger. Backhead minor is also become bigger. Now, the last and final thing to do are your glasses. So you got to remember, sometimes this does tend to absorb dirty energy, but also stress energy. Yes. And so other than just cleaning your lenses, which you do regularly, I hope, clean out now your glasses or the patient's glasses with green, orange, electric violet. Clean it out, green, orange, electric violet. Now, some of you just use reading glasses. At other points, you don't, so it might be much lighter. But those of you who wear it through the day, right, you need to clean it out. Green, orange, and electric violet. Now, that's quite clean for me. I'm happy with that. And so, cleaning my hands. Clean out, clean out. And then once you're done, you can ask them now to take the same piece of paper that they did earlier, right? And now try and check on the ability to read. So earlier I had to squint my eyes, for example, before I could read a line. Now I don't feel, I didn't have to bring it that close. Even at this distance, I can read. Did you know, right? Refrain from setting for air when you buy ice cream. I have no idea what I'm reading, but anyway, that's what's written here. And so you will notice that without glasses, reading has become much better. And even the font at the distance that I could earlier not read very clearly, I can see the fonts pretty clearly at this point. The smaller fonts are still a bit blurry, but the second biggest fonts are now visible to me already. Yes. So if you can get feedback, both with those of you who've done self-healing and with your patients, try and find out what is happening to their eyes. Yeah. Do not take those glasses yet. All right. Hold on. All right, Radhika, you have a question?
Atma Namaste, ma'am.
Atma Namaste, ma'am.
I'm
Radhika,
so
ma'am.
I'm so excited to go through this whole thing because I have a patient who cannot see from the right eye
Okay.
because optic nerve has completely atrophied with a small gap for some light is visible but no vision in the right eye.
All right.
So I had some queries. First thing, when I was listening to you, you kept saying optic nerve. So
Yes,
whatever we are energizing is going to the optic nerve also.
correct.
But this atrophied optic nerve, what else I need to do for that right eye atrophied optic nerve? Do I need to clean
Well,
that optic nerve?
well, that's why we did the thorough cleansing of the physical eye, dividing it into the 6 parts, correct? And so that would help you. You can clean out with the intention only the optic nerve as well. Now, when it's atrophied, you realize that it's not functioning properly. And the 2 colors that we've used are basically the colors of regeneration. So that should definitely make a big difference.
Ma'am, while energizing, you are sending it and you kept saying optic nerve. So I said,
Yes,
aha, so just that will work on the nerve also.
of
But
course.
that will, so the atrophied part will regenerate.
In time, hopefully, yes, if the karma
Yes, yes.
allows.
Yes. That definitely it is the karmic angle also. But as a healer, I have to put in the efforts.
Correct.
So
Now, the other thing also is for this patient to provide, if they are in a position to financially support eye surgeries in India. So let them provide for, say, 10 eye surgeries. It could be cataract or whatever. It's about 800 rupees, 500 rupees. So let them start doing that. And then you, as a healer, decree that the good karma generated in giving other people better eyesight manifests in this person's eyes with better eyesight sooner or later.
definitely I will do that. Regarding the cleaning part of the optic nerve, do I have to visualize the optic nerve in front of me and clean
You
it?
can, and just intend for your fingers to go through the optic nerve to clean it out, which might take longer, but remember using fingers and be very gentle because the eye is a very delicate organ and the meridians in the eye are very tiny.
One more doubt I had. When you have shown the diagram, you have shown the lines like you have drawn the eye, the middle line is clear, but the outer lines, you have literally drawn it when I open the eye on top of the lid
Correct.
and
That's why we
close
asked you
it
to
again.
look down. You had to look down and then clean out that part. Remember? And then for the
Yes,
lower
ma'am.
part, you had to ask the person to look up and then clean it out.
So, when we are visualizing, we are visualizing this
You
line,
visualize the ball. The eye is like a ball, correct?
right, ma'am,
So you
right?
visualize the ball, you're visualizing the top portion, the middle portion, the bottom portion. Yes, because
So, it,
your physical eye doesn't look like a ball. It has a different shape. It has a, yes. And so
yes.
that's not what we're looking at. We're looking at the physical eye. Yeah. But for
So
the
you are
sake of movement, it will be shown that it is at that upper portion and the lower portion of the visible physical eye. Yes.
right, ma'am. So when we are cleaning, actually, we are cleaning the top one third of the eyeball, middle of the
Correct.
eyeball, bottom of the eyeball.
Correct. Correct.
And this is the way you said look down, look up, depending on where you're cleaning.
Correct. To
Now, if the
avoid
person,
over energizing the eye while cleaning. That's all.
if I'm doing distant healing, I just have to imagine the eye of the
Yes.
patient in
If
that.
the person is not physically with you, you don't have to do so.
A very fundamental question which I need to ask, ma'am. Here, you have not told how many cycles, nothing.
That's why you have to feel, correct?
You have to feel it.
Because by
Now,
now
when
you all are better healers. You don't need me to say 100 times or 200 times. You should
not
be able
that
to
way,
do
ma'am.
this.
I'm following other protocols from the advanced book. Now
Correct.
it says you do 3 times, energize 3 times with light whitish green and 3 times with light whitish, 5 times with light whitish violet.
Correct.
So I have been just literally following 3 and 5, but I should energize with 3 till I feel a pushback, energize with light violet till I do a fully proof spa?
Correct. So now that you've done the first healing might require more energy. So you'll notice that it's taken maybe 2 or 3 cycles of full pranic breathing. That's why I told you all inhale, hold, exhale, hold. But when you do it day after tomorrow, you will notice that the number of cycles have already started reducing because the body doesn't need as much. Correct? But overall, usually they say about 10 cycles for all new students who've started with advanced pranic healing with colors.
So this rule is valid for any protocol in the advanced group.
You can, yes. You have to become more intuitive with your healing as time goes, right? You can't say, oh, it just says only 2 cycles, so 2 cycles. So a person who's got just a mild, say, issue with the physical eye will require very little energy to revive it and heal it. Whereas someone who's had it from the time they were a child would take obviously more energy than the second patient, correct? And so it will vary from patient to patient, okay?
The healing will come only after you give a 12-hour gap. Otherwise, the healing is nullified. A 12-hour gap to
You
put on the
see, the
glasses
delicate
again.
part, you do not want to over-energize it. That's it.
No, ma'am. Regarding wearing the glasses, you started off with that. Don't wear glasses for the next 24 hours. So a
Correct.
person who
And
needs
so
to
that's
wear
why it's
glasses all the
preferable to
time.
do it at night. Yeah. If they're wearing glasses, it's preferable you do it at night so you don't feel the need to put the glasses on during the day.
So that gap is a must for the healing to occur.
You think about it. I'm going to go to the next person. Yeah, you've taken a lot of time. Thank you.
Thank you so much. Thank you.
No problem. Yeah. Let's go ahead.
Atma Namaste, ma'am.
Atma Namaste.
So if you do this regularly, my
Yes.
sight is -4. What are the chances it goes to 0?
I'm not sure about 0 yet, but it should start to become better, which means you'll have to go back to your ophthalmologist and get glasses with less power.
Yeah, because if you keep doing this and wearing these, it will affect you worse.
Yes, it will. And so in a couple of weeks or so, if you start feeling that these glasses are not doing justice, then you will have to go and get a new set of glasses. So till you feel you have the motivation to heal yourself, maybe pick up the frames that are suitable for you and you can change the lens.
Okay. If you want to keep your eyesight still, you know, as the line when you look at the sea. When you look at the sea, there's a line. You keep looking at it 5 minutes, your eyesight will never reduce. Because it helps you to focus, basically.
Correct. So you can do other eye exercises. So there are times that Master Chua, with this particular protocol, we would be at a dinner table and he would tell all people who are wearing glasses, take off your glasses, and he would do the healing and say, okay, now take the newspaper and read it. So that's where I'm coming from when I asked you to bring a piece of paper. That's what he would do. And he would say, you cannot wear your glasses now. And normally it's dinner. So most people don't need glasses and they come the next day saying that there's been a great improvement. I'm sure most of you are noticing things already, but if you do it regularly, which is going to be important, especially when it's self-healing.
Thank you. One more thing. I've sent you a message on your direct chat if you have a look at it later when you finish.
Yes, I will.
Thank
yeah?
you. Thank you so
All right.
much.
Thank you. All right, let's go to the next person.
Atma Namaste, ma'am.
Atma Namaste.
My question is similar to Ms. Radhika, but my patient had a small surgery also in the eyes. His optical nerve is damaged and he got lot of blood clots inside the eyes. Actually, he was hit by the badminton racket while playing.
Okay.
So it's almost 1.5 months now. The vision is totally gone. Till now, the vision is not back. Slowly, I think he's able to see the lights now. Okay, so do I use the same protocol? What we just
Yes,
used?
you can start to use this protocol because the colors are regenerative and the cleansing will help to hopefully also dissolve the blood clots in his physical eye.
Okay, so what I have been doing till now was similar to this, but I was soaking the eyes through the crown chakra, through the brain, and I was cleaning the occipital
No,
lobes.
you have to remember that the organ that controls the chakra that controls this particular organ is not the crown.
Through the brain, Ajna also I was doing. I was cleaning Ajna, temple, back head.
Correct, but the crown does not control the physical eyes.
Oh, that is okay, fine. So same protocol I should use, right? Along with the
I think it would
psychotherapy
be
I was
more
doing.
effective, yes.
Fine, ma'am. Thank you so much, ma'am.
Yeah, thank you. Alka,
I'm not being able to. Yeah. Atma Namaste, Sumi.
Namaste, Alka. You were waiting for your face to be seen. Go ahead.
So, yeah. So, I have a patient, a small girl actually. She's 10 years old and she has myopia. So, she started with 0.5 and suddenly in a year it jumped to 2.5.
Wow.
Her karma. Yeah. And then it kept increasing by 1 point. So, she's already at around 3.75 something. So, I started a healing a year back, literally. So, originally it got arrested. For 6 months, it did not increase, but the power was still there. And recently, it has increased, though minute, but still increased. I'm following the same protocol which we discussed today. I have been
Okay.
following.
Okay.
Just that I've added the forehead in there and crown as well. But just now I heard that crown has no link with the physical eye.
It doesn't, but you have the flow of the energy. So if the person has more of an issue with the left eye, the forehead controls the left eye. The right eye is controlled by the Agnya chakra. So doing that, yes. But I think in this case, if the child is just 10 and has this condition, it's definitely karmic. So you need to help them neutralize that karma with doing tithing for eye surgeries. Yeah, and decreeing that. That would be important because with the healing, you were able to arrest it for about 6 months. But then karma took over.
Hmm.
Okay. All right. No problem. Okay. We'll take 3 more questions. Huh. My God, I don't think we're going to be teaching anything more than this because in 15 minutes we have to finish the class. All right, let's go ahead. Yeah.
Am I audible?
Not really.
Just help me. Am I audible now?
Yes, go ahead.
Okay. So, my sister's daughter, she is mentally challenged, autistic, and have partially blindness.
Okay, Pooja.
Her biological age is 35 now, but she is very well versed with music and everything.
Of course, yeah,
But,
they have those talents.
yeah.
Yes.
So now, while healing, the problem is she moves a lot. So this healing can be done while she is sleeping.
Does she wear glasses?
Yeah.
Okay, so then preferably maybe at night
Sorry to
to help her.
disturb. The diagnosis was my sister has not taken rubella, this injection vaccination.
Yeah.
During
Correct. But if you're just asking about the eye, since we're talking only about the physical eye,
Yeah.
I would suggest you can do it at night for this niece of yours.
Okay. Okay. Thank you
Yeah.
so much.
All right. Okay. Second last question.
Atma Namaste.
Atma Namaste.
I am treating somebody for a retina detachment.
Yes.
And I got the protocol from somebody senior from PH Protocols group. I'm finding your protocol much simpler and it's somehow I'm relating to it better. So can I use the same protocol with the intention of even regenerating or just healing the retina?
I think you should, and you can combine it with whatever else Marilet from PH Protocols has sent you. Now, one of the things that I should say at this point is this seems very simple, but this is only for the physical eye. Sometimes there are other things that are required for a patient. So, of course, take care of the rest as well, of the rest of the aura, the chakras involved.
Okay, just one more question on healing.
Sure.
So we did intend in the beginning that I want my eyes to be healed. By the way, miraculous 3 inches improvement. I measured it's actually there and it just feels
Okay.
great. So
I'm
thank you
glad.
so much.
Yes.
But we intended in the beginning, and then we are just focusing on okay, throat green, crown violet. We are not saying every time disintegrate, remove diseased energy.
No, you don't have to. Your intention is there, right?
So
As long as the intention is to clean out, to remove the blocks, to remove any kind of diseased energy, painful energy, if any, that's all that's important. So remember, intention matters in healing.
Yeah, but to recall it in my mind in the beginning to just
Is enough, yes, because your movement is based on that intention, right?
right.
That's
Yes.
why I tell you to try and close your eyes. So you focus on your patient if necessary, if it's distant. Otherwise, you get distracted by sounds, people, and others, which is not the way I've seen Masacho heal.
Understood. Yes.
Yeah.
Thank
All
you.
right. Okay, and who else? Jagdeep Kaur, the last question. That's you? No, I can't see the person.
Hi,
Hi.
my name is.
Hi, Atma Namaste.
So I was doing. I also wear glasses as visible. So I was doing, this from the advanced book.
Did you
The
do the
protocol
healing
that I was
today
using.
for yourself?
Yeah, I did. I followed your protocol.
But you're not supposed to wear glasses. That's why I'm asking you.
So I removed the glasses while I was doing it.
No, you're not supposed to wear the glasses for the whole day.
Then I won't be able to see.
That's
Okay.
okay. We can see you.
Hello?
Yes.
Yeah. So my question was, in the advanced protocol, the one which is mentioned in the book, advanced book, it was we were sweeping, energizing, sweeping, energizing. So can we, tweak because you were projecting colors, and so can we tweak for other protocols also, or we have to go by the book?
You'll have to give me an understanding of what you're trying to talk about. What do you mean by you're going to tweak?
What happens when you project the colors, before cleansing? So how does
It
that make
depends. For example, in arthritis, you're supposed to project a green and orange into the minor chakras of the arms and legs, then sweep it out, then energize with green, blue, violet. So there are protocols where the need is there to basically loosen the dirty, old, used up energy before you clean it out. So it
But
depends on your protocol.
but it's not mentioned in the advanced book, this projecting of the colors.
Projecting of
there.
colors is taught to you in the advanced pranic healing course.
Okay.
No. Well, when I used to teach advanced pranic healing, yes, I did teach projection of colors before you start to clean it out.
Okay, fine.
Yeah.
I'll check with my trainer once again.
Sure, please do.
Yeah.
Yep. All right. So with
Thank
that,
you.
you're welcome. So with that, we'll end with the questions for now. Let's go back. I will have to change my screen else. Hold on. All right. So for the sake of the class, I'll have to pin myself. Yeah, so let's just more or less we're at the end of the class. So let's try and put this together. So once again, we're talking about the physical eye. And so the colors were gold, light whitish greenish violet, light whitish greenish yellow. Remember, in light whitish greenish violet, violet is slightly more than green. Yes, so you project the color, you clean out the organ, in this case, the eye, and then you energize it. Yes, so that's basically what we've done. Once you finish with that, clean out the glasses so the patient doesn't use it. So I had this gentleman who used to come, and he would wear very, very thick glasses. He worked in the IT industry. And when we started off the healing, he would come. He was also a healer, and he would do healing for himself and others. But he wanted to get one healing done. So he'd come to the foundation office and I would do healing for him. And then I would give him the same protocol to do for himself when he goes back. And after about, I think about 3 months of regular healing, he came back to me and he says, Sumi, because he used to take the afternoon off to come for the healing. He said, for the first time, it started to rain and he saw raindrops in his life. For me, seeing raindrops or seeing rain is quite normal, but he says, my vision is so bad that I could never see. And for the first time, I was able to see raindrops. And my heart melted when I heard that. I was like, oh my God, can you imagine what Master Cho has given us for this young man? He was very young. He was in his late 20s, early 30s max. And he said, I was able to see that. Just that one portion that he mentioned made it worthwhile, all the healings that I've done for the longest time. I was like, wow, if this is what I can do for someone, why not? Correct. And he continued healing himself. And one eye was literally, I mean, he would say it's almost non-existent. But because the other eye works well enough, he was able to use that eye to do all his work. And slowly, the vision in both the eyes started to become better, improve. And he had to get married. And he says, I'm not too sure what to say because we practice honesty in Arabic yoga. So what should I do? So I said, you be honest with the woman. Tell her exactly what your condition is before you marry her, because she needs to know what she's getting into. And they happily married till date. And his vision is still improving, hasn't completely normalized. But for him, it's an amazing jump from where he was. Yes. So don't stop with what you're doing. It might seem simple. It might seem not too much when we do or take the time to do for someone, but it might transform someone else's life. I just wanted to share that because you and I inspire each other. Yes, when I don't remember the lady's name, when she said she saw an improvement of 3 inches. That's amazing because it's not possible to do something like that in a span of 20 minutes or even half an hour. Yes, and you are able to achieve this. And this is for you to see that there is an amazing change in the physical eye of the body with reference to this. Yes. So I know we haven't gotten back to our chapter yet. It doesn't make sense for me to start this on the 6th of February when we meet again. We will continue with this protocol. Yes, I know there are a lot of questions there. I'm not sure how easy it's going to be for me to look at that because it is a little blurry for me without my reading glasses. Yes. But overall, I hope you've had a good experience with this particular protocol. And we will do, of course, when you come back the next time. I don't want to see my face anymore. We will have the ability to you will tell me in the next 2 weeks, if you've been continuously healing, what is the result of healing? Because I noticed that many of you are wearing glasses, correct? And I noticed many of you have taken it off, right? But I know 1 or 2 of you are still wearing the glasses. I can still see without my reading glasses. So if you've done the protocol, please take off your glasses. Try not to use your glasses for the rest of the day. Yes, to allow the time that you've taken to work on your eyes to actually show an improvement. Yes. And so with that, it's 3-4 minutes before we end for today. I'm going to ask you to kindly close your eyes. We'll end with a prayer. And if you have very important questions, keep it for the 6th of Feb, and I will look at it. Yes. So let's end the session. To the Supreme Being, the Divine Father, Divine Mother, to our beloved and respected teacher, Grandmaster Cho Sri Lord Mahaguruji Mailing, to all the beings, to all the angels present with us. Thank you for all the healing. Thank you for your blessings, for the healing energy, for the healing powers. We thank you with tremendous gratitude, with deep, deep respect and much love. Thank you for accepting us as instruments to do healing. Thank you for healing me if I was the patient or my patient. We ask that a healing minister, healing angel be assigned to this person to continue with the healing. With thanks and in full faith, so be it. To everyone in the room, Atma Namaste. Thank you for being with us. See you at the retreats, or as Sri Ram said, on the 6th of Feb. Why do I keep saying 7th? The 6th of Feb. Yes, tomorrow is a full moon, so you might even see Sri Ram on the full moon. He will be taking care of it tomorrow. Yeah. Thank you. Atma Namaste. Take care. Bye-bye.